Hi, I'm Sheryl Samara. I work at Liverpool Hospital. My department is Staff Health Vaccination Service. Okay, about Sheryl, my mob on my dad's side are from Geraldton, they're Yamaji, and my granny was born in Nabawa, which is about 30 kilometres outside Geraldton, and she's part of this stolen generation. Information is a little bit disjointed, but I have met some of the mob, and I went back there in 2010. I think it was, and took my shoes off and walked along the beach and tried to retrace where my mob had been. On my mum's side, we are from the Wiradjuri people, and I can trace my family back to the Fullers, and the Fullers go back as far as Bennelong. So I haven't met a lot of mob. I need to go out there and meet some more mob. My grandmother did a lot of hidden generation stuff. Okay, what was I doing before I was working at Liverpool Hospital? I was raising 3 children. I had 2 of those children when I was a member of the Australian Defence Force. I was in the Army for 5 years, and then I married a soldier, and I was working part-time as a AIN at one of the nursing homes, and I got a bit frustrated. I thought, I can do this. I'd watch RN, so I went off to university and I did my training through, then it was called the Milpera Institute, and then it became the University of Western Sydney. And when I graduated, I did the new grad program at Liverpool. Okay, I've been working at Liverpool Hospital for over 20 years now. I did the new grad program, and then I moved to Port Augusta for a few years. My husband stayed in the defence for 23 years, so and I came back and I did my midwifery through Liverpool Hospital. Then I left again. I went to Victoria for 10 years, and I came back and I worked in school immunisation program. Then I worked in sexual health, and then I did the Aboriginal initiative through the New South Wales Ministry of Health, and I did my Masters in Public Health. Then I went off and did a 18-month gig in mental health, and then I've been in this role for almost 2 years now in staff vaccination. I actually started my nursing career at another hospital, and they didn't have a good new grad program, so I took my own initiative because I had some friends that worked at Liverpool, and they thought, oh no, they'll look after you better than that. I went and met with the Director of Nursing and had an interview about coming onto the new grad program. Okay, so what brings me back? First of all, Liverpool feels very much like home, and I lived at Holsworthy for so many years. There's a bit of laziness in there that I didn't enjoy travelling 3 hours a day, and I thought I wanted that time back. And I like Liverpool Hospital, even though every time I'd get here it takes you a couple of days to reorientate because the hospital's probably doubled in size while you were gone. And so you'd have to work, don't ask me where anything is just yet. I'm still working it out. It just always feels like my hospital. Even though I've worked at Port Augusta Hospital, I've worked at Auburn, I've worked at Fairfield, I've worked in the community in country Victoria where you'd travel 100 kilometres just to do a dressing. All different places. This feels like coming home. I started off in short stay surgical as a new grad. Then I moved to orthopaedics. I then left here and I went and worked for Sydney Home Nursing Service because I wanted to be more accessible to my children. And then I left there because I wasn't more accessible to my children, and I came back. This is pre-mobile phones for all you youngsters. There was a time with no phones. If one of my children had injured themselves and they couldn't contact me while I was working in the community, and so I had to be where you could get a telephone to do my role as a mum. And so then what was my journey after that? We went to Port Augusta. I worked for a couple of years in Port Augusta. We came back and then I did my midwifery training, and I did my prac here at Liverpool, and I did my university through UWS. A few months after I graduated, we moved to Victoria, and then I went to country Victoria for 10 years till I came back. And then when I came back here, I came back as part of the immunisation program in 2004. I did the meningococcal C program, and I did my nurse immuniser. I then broke my wrist and I had to stop doing a position where I had to do like repetitive work because I couldn't vaccinate more than 100 in a day while my wrist was healing. I then went to sexual health, and that was really interesting. I stayed in that role for 7 years, and I became the area Aboriginal sexual health nurse across Sydney Local Health District and southwestern Sydney. And then in 2011 I took advantage of the New South Wales Health program where you could do your Masters in Public Health, and I did that working with health promotion. And then when I'd finished that, there was no role for me because I had to leave a full-time job and go into a part-time contract while I did that gig. And I went off to mental health for 18 months, and that was a very hard work. Any of you that want to work in mental health, wow, hats off to you. Very hard job. And then I came back to the hospital where I've been employed as the clinical nurse consultant in staff vaccination, which is my current role. I've been one to take advantage of what's on offer. So when the sexual health training came up, I grabbed that with both hands because they trained me. I've got a postgrad certificate in venereology and I've got the family planning certificates, and I did a lot of health promotion work. I was just wanting to take advantage. I'm one of these people that feel that the more educated you are, the more opportunities you have. So that's why I try to impart with people, even when they come into the staff vaccination service. I want to educate them about what I'm asking them for so that they have an understanding. So it's not just do everything by the numbers, so that people understand. People, once they have been educated, make different choices. So that's really all I've done, is take advantage of opportunities as they arise. Okay, as a clinical nurse consultant in staff health, I've got quite a varied role. So one of those is I've just finished a major, well no I haven't finished, still got one more week, a major influenza vaccine push where two of us have delivered over 3,600 vaccines on our own for flu vaccine. We got our winter surge help a month after we started. We've had some help which has been really good. There's a lot of work for two people. In fact, I think there should be two more people. So flu vaccines is one part of my role, so that takes out 2 months out of our year, but at the same time we also do recruitment. We do occupational vaccine and screening clearances for all new staff, and not just new staff, we do it for contracts, we do it for any change of position. Each time someone goes for a new role in health, we have to do the occupational vaccine screening clearance. So with that, I have to ask people to provide their vaccination cards, their serology reports, and I have to assess to see whether or not they meet the PD 2018_009, which is the Occupational Assessment and Vaccine Screening Policy by New South Wales Health, which just changed in March 2018. So I have to go through all that, and that's one of the things that I like to educate staff members, that they are responsible for their own vaccine records, and encourage them to keep them safe, how to look after them, and what the requirements are. So yeah, it's quite varied. And as well as that, I also look after all the needle stick injuries in the hospital. So I developed a package that went to emergencies, so that when they are assessed through the ED by the doctors and the nurse practitioners there, so that there's a checklist that can be done, and then after the weekend or out of hours I then get the file and I review them and I call the staff member up. If needed, I then consult with clinicians in immunology and gastrology, and sometimes I also consult with work health and safety if it had been an occupational exposure as far as radiation. There's a lot in the job, and I also am involved with the infection prevention team, so I have to generate reports. I'm also involved with a committee setting up the first ever state staff health conference, which I'm really excited about. It's a really hard job, lots of needs. Why do we want to know the vaccination status of all of our new recruits? Because we want to be able to prevent vaccine-preventable diseases such as measles, mumps, rubella, hepatitis B, and also vaccinations for tetanus, diphtheria and pertussis, which is, most of you will know, is the whooping cough vaccine when your mob are having babies and they say if you don't have it you can't see the baby. So that's why we need to. So if we can prevent a disease, we don't want to pass it on to patients, and we don't want to pick one up from a patient and take it home to our family. Well, a day in the life of Sheryl is quite varied. What do I do on most days? I review the records for new staff. So a lot of staff have started here and their records are not complete, so I ask them to bring in all their records and then I'll review them because I'm trying to get them complete within 1 month of them starting. So I normally have to do a TB assessment, which is I'll ask them a lot of questions that should have been filled out in their information pack but mostly isn't, and refer them if appropriate, but mostly I don't need to, and so then I just document that they meet the requirements, and then I need to assess their records. If they don't have a vaccine card, I generate one for them and then educate them quite firmly that this new record that I'm giving them is a medical record and they need to look after it, because I won't ever issue them another one, and to look after it just like they would with their CV and their passport. It's an important document. But again, educating them as to why they need their vaccines, and we talk about that it's vaccine preventable, that measles, mumps, rubella, varicella and whooping cough and diphtheria, they're all airborne, and influenza, and as air-breathing individuals, we're all at risk of all of these vaccine-preventable diseases, and that's why it's so important that we have all their records up to date. Okay, so the team that I work with in Liverpool Staff Health, there's myself as the CNC. I've also got an admin officer. I've also got the staff health coordinator who set the unit up. One of the things that I really enjoy about my role is education, because I really do like educating people. So I believe that if you understand why, it's easier to comply. So I spend a lot of time with people so that they do understand, particularly with looking at blood results, and so that I can explain, oh, this is why you need this vaccine, or this is why I need to refer you, so that it's not just do this because I've told you, it's do this because you understand. My proudest moment in staff health, I don't know. Some days I feel that is a job well done, or if somebody comes, I've had some students come that are at the end of their tether, that they've just been told to go here, go there, this is what you must do, and they've not understood, and at the end I've been able to pull it together, make them fully compliant and help them understand what their role in their compliance was and what they need to stay compliant, and they thanked me for it, and I thought, well, I'm just doing my job. So that I felt really good about, that I'm helping people to get their records together so that they have it for the rest of their career. I actually say I've been nursing for 30 years and you will need this, look after it. Also discuss with them how to make copies, how to keep the original safe, and charge them with the responsibility. Working with our community, I actually get quite delighted when I have any of our mob come through, and I get to sit there and explain the record so that they have a good knowledge and understanding of what it is they've been asked to do. And I share a little bit about who my mob is. I've got some of my art on the wall, and I like connecting with our mob. Oh, I love connecting with our mob. It's more than like, it's great. I think I want more to come. And again, I think it's that whole not to be scared of vaccines. And I often discuss that when I grew up, because I'm now 60 years old, when I grew up, kids would be in my class in calipers, or when from polio. And polio is a vaccine preventable disease that we really don't see in Australia, but we would see in a third world country. But in Australia, we don't see it at all. Also, the consequences of the measles virus. So when my children were babies, there'd be children up the road dying of measles, encephalitis, or measles on the brain. You don't see that happen anymore. And just talk about how important I think that vaccines are, and how we have healthier mobs, healthier communities because of vaccinations, and not to be scared of them. The importance of seeing Aboriginal health professionals, and regardless of whether, when I first started my whole work career, when I was in the army, my first 12 months when I was in the army, I was under punishment because I was immature and had a fight with my roommate. So I had to be a cleaner. So I went from being a cleaner to a pay rep, and then when I got out of the army and had my children, and then came into health, it doesn't matter where you started, you just keep looking, thinking, I can do that. I can do that. By seeing other people doing things, you think, well, I can do that. I'm as smart as them, but I would actually hope you do better than me. Go further. Us older people want you to get up on our shoulders and go further. So it's really just an example of where you can start. Okay, benefits of working in health. I see one of the benefits is that there's so many different opportunities. You can start as a cleaner and end up as a doctor. So it's your pathway, it's where you start. It's all about education. So you might come in and not have a really good education to start with, but once you start learning the basics, and I've worked with people that started off as an AIN and then went and did enrolled nursing, then did nursing, and then went off and did medicine. So you don't have to limit yourself. You just have to have a goal and keep working towards it. Sometimes we do limit ourselves. So I actually think I would have made a really good doctor, but I didn't think that I could, because I ended up the 18 pregnant in the army, having to take time off, having the baby, going back in the army, and getting married, and then having a few more children. I didn't think that all those opportunities were there, but I've done over 15 years worth of university. I could have done medicine twice over. So, but it was my own self-limitations there. But now at 60, I don't want to do medicine. Still might do my PhD, don't know. Thinking about it. That's my next goal, my next Everest, as you'd like to put it. That it's always something that I wanted to climb, and I haven't yet got there. So while my brain is still working, I might get there. But I would like to think that don't limit yourself. And the benefits of working is a regular paycheck. Wow. Regular paycheck is great. You can, buy the fancy shoes, the nice outfit, good hairdos, not mine, the nice clothes, you can buy a house, you can buy tucker. I can remember there were times when I didn't have a regular job or a regular income, when you weren't always sure you could put enough food on the table for yourself and your kids. So those days are gone. So it's a benefit of having a full-time job. Okay, skills to be a nurse. One of those is to be honest, to like people. Don't go into nursing if you don't like people. Be honest when you don't know something. Ask questions. And if there's something that you'd like to do that needs for you to learn a new skill set, you let people know that you want to know the skill set. We have yearly appraisals, and I need to know more about blood and body fluid exposures, so I need to go and study some more about hepatitis C, about hepatitis B, about HIV, so I need to go off and do it. In fact, I went in my own time a few weeks ago to learn more about hepatitis B. So I'm forever learning, so it's about learning so you can pass on information. And so one of those things is that I'm always honest if I don't know. If you don't know, it's okay. You don't have to know everything. So you just ask. When you stuff up, which you're bound to, you have integrity and just say, look, I stuffed up. I shouldn't have done that. How can I fix it? What do I need? Do I need to report it? Do I need to put NIMS in? Because stuff happens. So I believe it's really important to have Aboriginal staff members across the hospital, so that when our mob comes in, because there's times when our mob need to be in the hospital, they can relate to us, they can see us there. But it's also when their families come in, they see us there, and we can be an example to our mob and to their families, their extended families, that there's room for you in health.